Next mobilization with movement technique is to mobilize the hip joint. So a lot of times we get those tight hip flexors and our hips don't want to extend. So this is a quick and easy way to mobilize someone's hip joint without having to really lift a heavy hip, and you kind of let them do the motion, and you're just going to facilitate with your hands. So this works really good with patients who have low back pain, they're constantly in extension, or your stenosis patients, which are kind of that end range extension. And so not only are you getting the anterior glide of the femur into extension, but you're also getting the myofascial hip flexor stretch. So Chris, if you could just go ahead and stand up nice and erect. And what you're going to do is kind of come right below the gluteal fold there, and you're going to have cue Chris to moving his hips forward while you kind of slow down the femur and you're gliding it anteriorly with your hand. And you're just going to have them go back and forth like that as you mobilize the hip joint. Sometimes if it's too much motion, or if they're too tight, there'll be too much extension here because they don't have the hip motion, so you might actually have to cue them to bring their nose to the floor a little bit. So Chris, if you could bring your nose to the floor, that will actually flex them a little bit. And again, you would just do the same mobilization as you kind of pull the femur backwards into that extension, but then at the joint line, you're gliding it anteriorly to facilitate the normal biomechanics.